Hi, my name is Takara Pinson, and my presentation is over the hepatitis C virus. The liver is the largest organ in the body, and it plays an important role in most of the body's function, including food digestion, energy storage, and waste removal. When faced with hepatitis C, the liver may no longer be able to perform these functions. Hepatitis C is a viral infection that causes the liver to become inflamed, and the word hepatitis actually means inflammation of the liver. It is spread through contact with blood of an infected person. Hepatitis C is known as a flavivirus and accounts for 90% of the cases that are either non A or non B hepatitis in the United States. The structure of hepatitis is described as a core of single stranded RNA surrounded by a protective shell of protein, which is then encased in a lipid shell of cellular material. The genetic information is stored in the RNA instead of the DNA, giving the virus the perfect setting for mutation. Hepatitis C can be either acute or chronic. Acute meaning the illness is short term and occurs within the first 6 months of exposure. Many people with Hep C, with acute Hep C, end up with chronic Hep C. Chronic Hep C means that the illness is long term, and this happens when the Hep C virus remains in the body for a long period of time and it may last a lifetime. This can then lead to serious liver damage, including chronic liver disease, cirrhosis, liver failure, and even liver cancer. Chronic Hep C affects 2.7 to 3.9 million Americans. Most of those who are considered baby boomers, which mean they were born between the years 1945 and 1965. And as I already said, it accounts for 90% of the causes of non A and non B hepatitis in the United States. Others most likely to get Hep C include people under 30 who inject heroin or misuse prescription opioids by injecting them, people who have had blood transfusions or organ transplants before July of 1992, people in contact with blood or infected needles at work, babies born to an infected mother, people who live or work in a prison, people who have tattoos or body piercings, people who have had multiple sex partners within the last 6 months, and people who have been on kidney dialysis. Many of these people are unaware that they are infected with Hep C because they do not have any symptoms. A person cannot get Hep C by being sneezed on or coughed on by an infected person, sharing eating utensils or drinking water behind an infected person, or even hugging or shaking or holding hands with an infected person. Although many people with Hep C do not have any symptoms, those who have the acute infection may develop symptoms within 1 to 3 months after exposure of the virus. Many people who have symptoms of Hep C may overlook them because they may feel like flu symptoms. Those symptoms may include dark yellow urine, fatigue, fever, gray or clay colored stool, joint pain, loss of appetite, nausea, abdominal pain, and even jaundice. People who have chronic infection may not start to get any symptoms until complications from the virus begin, which could be decades after they were infected. This is why screening is important for early detection, especially for baby boomers. Hep C is diagnosed by a doctor using a person's medical history, doing a physical exam, and running blood tests. They use a person's medical history to check if they are currently having symptoms of Hep C or have ever had any blood transfusion or have used injected drugs. The physical exam is to check for signs of liver damage, and those may include changes in skin color, edema to the lower extremities, or tenderness or swelling in the abdomen. Blood tests include screening for antibodies to identify if a person has been exposed to the Hep C virus. If positive, this means that a person has been exposed, but the virus may no longer be present in the body because the body has gotten rid of the infection on its own, which happens in some cases of acute hepatitis C. Once a person has a positive antibody screen, an RNA test may be done to determine if a person still has the Hep C virus and how much of it is in the blood. After the RNA test, a genotype blood test will be done to determine the strand or form of Hep C that a person has. And right now there are currently at least 6 different strands of Hep C, but the genotype 1 is the most common strand in the United States. These tests are all important in helping the doctor decide a treatment plan. More testing may be needed in people who have chronic Hep C to determine liver damage, including additional blood testing or an ultrasound. A liver biopsy may also be needed for severe liver damage. Treatment for Hep C, if detected early, in most cases can be cured with antiviral medications. Prescribed by a doctor, multiple antiviral drugs may be used, such as Harvoni or Olisol. There are also new direct-acting antiviral drugs that have been approved since 2013, such as Ribavirin. Treatment with these antivirals may take anywhere from 12 to 24 weeks, depending on the genotype, the extent of the liver damage, and if any treatment has been used in the past that failed. As in all medications, those used to treat Hep C may cause side effects and should be discussed with the doctor. In some cases, treatment is delayed until acute Hep C becomes chronic because of the body's ability to heal itself. Although researchers are working very hard to develop a vaccine for Hep C, one does not exist at this time. And even though there's not a vaccine for Hep C, there are many ways that you can prevent Hep C. You can do that by not sharing needles, wearing gloves when in contact with a person's blood or open sores, making sure your tattoo artist uses sterile tools, not sharing personal items such as toothbrushes, razors, or clippers, and using latex condoms during sex. Just by doing these simple things, the number of reported cases each year could be decreased dramatically. Thank you, guys.